Hello friends, hi, I'm Dr. Shonali Chandra, your Obs Gynae faculty at Prep Ladder, and we welcome students who are joining their MBBS journey with us. And so this is a very dramatic shift, so to say, from school to MBBS. I mean, you may be in your first year of college and maybe you're struggling for a footing there because it's a new environment altogether. And the structure of the course is different and a lot of expected out of you, a lot is expected from you yourself, you're expecting a lot as well. So it may be that you're still struggling to find out the good way to study and it's an overwhelming course to begin with, or maybe you're in that juncture where you have sort of figured it somehow, and you think that maybe whatever was working in school learning for you is going to work throughout your MBBS years. But as we shall see and we shall explore in this video, that not everything that we have picked up in school is going to continue to work for us, because there's something very drastically different if you look at MBBS learning, right? The first of all is the vast amount of course material. Right, the curriculum is exhaustive, right? We have 19 subjects we need to master. We have to pass every year in those subjects, right? And so we have your internal examinations, and we also have to qualify the NEET PG examination for a postgraduate courses. So it is a huge amount of material, and it is covered at a much faster pace as we are used to in our school learning years. Medical students must continuously master the clinical subjects, and also at the same time skill building, and academics apart, skill building is also equally important, and this has to continue throughout the years of the MBBS course structure. The learning approach is also drastically different. I mean, when you look at the school curriculum and the classroom-based teaching, it's more of a one-on-one, more of student-teacher interaction, and it is more of instructional kind of course structure where much more of hand-holding is also done, and more emphasis is on memorization of actual information, right? Whereas in your MBBS learning, you'll realize that much of the learning is actually self-directed, in the sense that you will be expected to read a lot on your own. There's more of concept-based learning, more of critical thinking and decision-making that is also involved. And you'll also realize that much of the MBBS learning, actually happens outside the lecture theatres, outside the formal classes. I mean, with more of case discussions, with more of clinical rotations, with more of independent reading, so to say. Right? Now, if you look also at the assessment style of the examinations, I mean, when we're talking about the school curriculum, we've all gone through that, how we are marked in the test paper, what kind of test paper we are used to giving, right? But in MBBS course structure, when you're giving your, annual exams, your professional exams, now, they're called professional exams for particular reasons, because a professional attitude is expected out of the MBBS graduates, because in the end, we're training to be doctors, right? So, apart from the theory examinations, which are long drawn theory questions, right? Apart from that, also your, vivas and your clinical questions and clinical case scenarios are discussed. So, in that sense, it is much more of critical thinking and decision making that is involved, because at the end of the day, what is going to be tested is that whether you can, identify a disease, identify an illness, and a treatment aspect. So we have to build those structures during the 5.5 years of MBBS, curriculum. So in the MBBS curriculum, you will have obviously theoretical learning, but that has to be integrated with clinical exposure, because that is what we're training to be, clinicians. So with that respect, what doesn't work? Or let's say, for example, why school techniques, don't work in the long run for us in the MBBS curriculum. I mean, most of us actually learnt it the hard way around. I mean, we tried something, it didn't work, then we tried something else. And obviously, we've always taken the help from our seniors. Seniors are our guiding forces, so they've tried something and then, they have come up with a solution to what works and they tell it to us, right? So here I am telling you what doesn't work, right? So yes, we have to have a balance of memorization, but much of the course structure will ask you to understand concepts, and just not understanding, you have to synthesize them. What do I mean by synthesis is, because see, the human body is very complex, right? And each of the systems of the human body, right, cannot be studied in isolation. What I'm trying to say is that, you cannot have your heart working separately, or your lungs working separately, or your kidneys working separately. It's the whole body that works together, right? So everything is connected, right? And you have to synthesize concepts, right? From different areas, you have to synthesize them into one big, understanding of the human body. So that is, in a broad sense, what I mean by understanding and synthesis of concepts. So in that sense, yes, rote memorization, ratification just doesn't work. There is a lot of information out there. There's no dearth of information. There is no limitation to what you can or could or should read, right? So in that sense, yes, rote memorization alone is not going to be helpful. I mean, there will be areas where you will be asked to mug something up, but that's very little of the course structure, right? Passive reading doesn't help. What I mean by passive reading is that you're just reading without synthesizing information, without condensing it into revisable chunks, without condensing them into concepts, right? So you will read pages and pages of information, and you have to condense that, let's say, for example, into a simple workable flow chart, or let's say a simple workable concept which can be applied to many clinical situations. So something like that. So yes, you'll have to analyze the text that you are reading, right? So passive reading alone will not help, because that will not help you build the deep knowledge that is required in the medical profession, that is required in critical situations, all right? Now, also remember that last minute cramming, something that we've all done in our lifetimes, will not be very helpful in your MBBS years as well. So yes, there's certain volatile areas where, we all will do some or the other bit of last minute cramming, right? Where we want to just cram the overnight and maybe, regurgitate it out in front of the examiner the next day. But then at the end of that day, it will all be gone. I mean, you just sleep for a couple of hours and that cramming is gone, because that is not how our brain works, So cramming does not reinforce your long-term memory at all, right? And in medical profession, in your medical course structure, when you are tested not just on one subject, but ultimately eventually on all the subjects together, right? So you can't say that I did anatomy in first year, so it is not going to be relevant, in your final year when you are doing surgery, or you say that I read pathology or physiology in first and second year, and it's not going to be relevant in medicine later on. Now that's not going to be true, right? So last minute cramming with such a huge amount of course material simply will not work, right? And also, like I said, isolating subjects does not also work. So in your school years, yes, you would do biology, finish it there, maybe chemistry, finish it there, physics, finish it there and everything. But that is not how it works in MBBS curriculum. All your subjects, barring a few, they're all interlinked, right? So you have to, draw the parallels between the different organ systems, between the different subjects as well. And you have to study them sort of together. The MBBS curriculum is definitely designed in a manner that in your first and second year, those are your foundational subjects, So you go slow, you start slow, but you build your foundations. I mean, and then on those foundations, you build the structure of the whole, medicine, surgery that, we're going to do eventually, of course. Now, leaving a revision for later is also something that is not going to be very helpful. I mean, gone are the times when, you would just revise before the exam and then, go ahead and give your exam. Maybe, yes, just for passing the exam, it is okay, but come on, when we are entering the MBBS course, just passing the exam is not the goal. right? Ultimately, your journey is just starting. The goal is to become good clinicians, right? Good doctors. The goal is to go ahead and qualify for your postgraduate courses, right? So with that long-term goal, revision can no longer be a part of your study cycle where it will be done someday. Whatever you are reading on a daily basis needs to be revised over and over again all throughout your 5.5 years. I mean, if you read just something once, it is very wishful thinking, however bright one may be, that you will always going to remember it. So please understand that medical education, the fields that you've entered, right, the fields that we are in, it is a lifelong journey of learning and adapting ourselves. Sometimes learning in certain patterns works, sometimes it doesn't work. So we will all have to adapt. There will be always new things to learn and update ourselves of, right? So how do we go about it? So first of all, one should understand the curriculum and build a routine around it, right? And this is something that most of us tend to start very late. And it's fine, when you enter into the MBBS college for the first time, it's just your first year, so you're adjusting to a new place, a new environment, college life and everything, and all that will go side by side as well, right? But then again, you have to focus on understanding the curriculum and slowly building a routine about it, and you will catch up. If not immediately, yes, definitely, as and when your exams will be rolled out, one does catch up with it, right? So your curriculum will involve theories and practicals and your skill labs, as you can see. There will be, seminars conducted in the college premises, not initially in the first year, yes, but from second year onwards, you do have clinical postings, though those postings are not that exhaustive in the second year, but yes, you're exposed to the clinical environment as well. So when you're starting out, yes, devote your time to studying, and once you've read something, you need to revise it later again. Your skill practice sessions will also be there. You will take adequate breaks in between. You will give time to your college life as well, right? And you will also give time to recreation and activities that you like. So you'll have to build a routine, which is very, very important. Set up a weekly schedule and schedule dedicated time slots or blocks for reading or revision, right? And engage with clinical experience as and when you get the opportunity. Like I said, from second year onwards, you will be you will be expected to attend these clinical postings, and many times, students skip that. So do not skip your clinical postings. Do not think that it is something that can be done later, okay? Because it is just that in the second year, you're just getting initiated into the clinical postings. You'll still have to figure out the hospital environment. So it is going to be slow. But then from third year onwards, you'll have clinical subjects. And then in fourth year, your final year, you'll have this whole lot of medicine, surgery, obs, gynae in your final years. All of these hardcore clinical subjects are going to come to you. And if you're not going to get into the habit of clinical postings, then it becomes very difficult to get into that routine and get into that pattern, ultimately in final year. Or let's say, for example, it becomes difficult to juggle clinical postings with studies because you've not initiated early, and you did not, let's say, try to build your routine around those postings. So it can be difficult if you are going to skip the initial rotation. So do them. Moreover, they're also very important because that is the whole purpose of our course, not just theory, but also, clinics, because that is where the real learning happens. You read a theory and you have to understand the clinical basis of it. You have to apply that theoretical knowledge into treating patients, into diagnosing diseases, right? So it will not happen if you're not going to engage in clinical postings and, obviously have a healthy downtime as well, relax and enjoy as well. Take out time for that as well. I mean, you don't need to be all the time bogged down by studies as well. The other thing that I would also like to tell you is that you need to protect your attention span. I mean, like I said, that you don't need to be bogged down by studies all the time. What I mean is that it's very important to understand, especially with a material that is so intensive and it requires so much of concentration and effort on our part to understand it, to grasp it, right? that you need to understand that, you can actually sit and concentrate with that much in depth, maybe for a good 60 minutes, for an hour, and maybe for an hour and a half at max, where you will be fully concentrated. So I think an average 45 to 60 minutes is good enough concentration. You start reading something, immediately you'll not be into it, right? You'll take 10-15 minutes to settle into a topic, right? And then you'll realize that, you're getting it, and getting it. And then simply, let's say 60 minutes down the line, and you'll be like exhausted again, you're reading, and then you'll realize that you're getting lost, you're getting distracted, something else is coming in your mind. And that's okay. That's okay. Take a break for 10 minutes. I mean, maybe you listen to a song, or, just grab a cup of coffee. I mean, just look away from your book for a while, right? So take those small breaks. Protect your attention span. By protecting it means realize that this is how the brain will work. Realize that you have to make most of those 1 hour sessions that you are going to plan into your reading, right? So slow and steady and consistent is the key, right? Now, with that note, when you are learning something new, okay, and you start reading the material. So first of all, what is the material? The material, ideally, please get into the habit of reading standard textbooks, okay? Students are sort of getting away from standard textbooks. Try to get back to them. Like, for example, you can have in your physiology, you will have Guyton or Ganong's. Guyton is much more exhaustive. Ganong's is a little less exhaustive. You'll have your, for example, Robbins for pathology. Now, these standard textbooks, they may seem, okay, they're huge in size, they're written in a paragraph manner, they're written in a storytelling kind of a manner, but that is what is beautiful about them, because they are making you correlate. They're making you correlate the factual information with clinical case scenarios, with clinical examples. And that is why they are exhaustive, because they are driving a point through, right? And you'll have to get into the groove of starting to read them, because if you don't start at all, right, and many students do that, they start it and they just don't persist, because they're thinking that it's not making sense, it is too much exhaustive, I study 4 pages and then I'm left with, and I condense it into just, let's say, I read a few pages and then I condense it into just half a paragraph of information worth remembering. And that is precisely what these textbooks do, that you read a lot, but they help you think, they help you develop that critical thinking, always connecting in between systems, always connecting clinical concepts with case examples, right? So these are the textbooks that help concept building, right? So concept building simply will not happen if I would just give a concept to you and ask you to mug it up. No, right? You will have to read the literature around it. You will have to read the material behind it, right? And the best place to find that material is in the standard textbooks, right? The only issue is that you don't get to finish reading them. And sometimes, you'll get to know from your seniors also that not all textbooks or not all areas from the textbook need to be read from cover to cover. There are certain key important aspects or key important areas that you need to read from those standard textbooks, right? The issue is that if you're not going to get into the habit, unfortunately, in your first and second year, if you don't use that opportunity to read these standard textbooks, you'll not get into the groove of reading them again. You'll not come back to it ever again, and the time will not come back, right? So right now, when you have more time at your hand, when your course structure is also a little bit slower, start reading the standard textbooks, right? Always ask why and how. These are 2 most important questions. Try to also summarize the information that you have read in your own words. Summarizing in your own words, that means that, you will make your own notes. Ultimately, in your exam, you will not write pages and pages of information. Okay, it doesn't work like that. You need to make one solid, let's say, for example, flow chart. And, you need to convey to your examiner that you understand the topic, you have synthesized the information about the topic, and you've presented it in a manner. If you don't get into the habit of writing it down, It won't come at the examination hall, right? If, let's say, for example, you're going to give your Viva examination, right? Again, you have to talk about the case. You have to give your answers. You have to you have to speak it out. You don't get into the habit. It doesn't come on the day of the examination out of nowhere, right? So you will have to summarize the information in your own words. Every time, focus on building the basics and concepts. It's like a building that we are building, it's like a big building that you are trying to build here. It doesn't stand without its foundation. Your first and second year are your foundational subjects, right? All clinical knowledge that you're going to go for ultimately, eventually, your third year, fourth year clinical subjects, and later on in life, right? Everything is going to be built on the foundation of your first year and second year subjects. Please don't think that anatomy I've done in first year, it will never be again useful. No, when you go to surgery, it will be useful. Your physiology, pathology will be useful when you go and read your medicine, right? Now, also keep learning with clinical scenarios, right? And again, where to find these clinical scenarios? Okay, there are faculties that help you. Sometimes they don't in your college. Then you go to your standard textbook. There it is written. And otherwise, yes, you will also have your, clinical rotations where you will have to learn with the patients, right? Now, have we seen this, right? We've done this. All of us have done this, we mark everything. We highlight everything, okay? And that's fine when your textbook is little bit, right? But when you have huge textbooks and you highlight everything that is given there, how do you come back to it? Because when you read it for the first time, everything seems important, right? Then you read it for the second time, you use a different color highlighter. You read it for the third time, you use a third color highlighter. At the end of the day, realizing that you've highlighted everything. You may remember it the whole day, then you'll remember it the next day also. 1 week down the line, without having seen it again, you'll forget it. Okay, at the end of the day, you'll realize, oh, I have highlighted this with that color, something hazy, paper flashing in front of me, but I do not recall the information. So what am I trying to tell you here? Recalling and retrieving the information that you have, memorized or you've understood, that is more important than just memorization. When you're treating patients also, you need to have quick access to your memory. This is what you read, this is what it was, and this is it, right? So like that, it has to work, and it comes with practice, right? But then we try to sometimes, we end up, sometimes believing that, highlighting without really, closing the book and thinking about what we read can help. And in this regard, we try to get trapped in the illusion of competence. I mean, we think that just because we have read something multiple times, you will remember it. That is the illusion of competence. Right, because you never tested yourself. Every time, see, the point is that, you read something, okay, then you're sitting at revision, open the textbook, all those highlighted areas, you're reading them again. And you think that you'll remember, because when you're reading it again, you're like, oh, I have read this, I know, I understand. This is the illusion of competence, right? So that is why summarizing in your own words, trying to recall information with your book closed, is so important. Please understand here the concept of short-term memory and long-term memory, okay? Whatever we see from the environment, let's say, for example, whatever grabs our attention, immediately, we can, okay, fine, it goes into a working memory or short-term memory. Think of it like, when somebody tells you their phone number, or when somebody asks you to, when you get the OTP on your phone, right, you immediately remember it, right, those 6 digits or 4 digits OTP, then you enter it someplace and then you forget about it, because the brain is not expected to remember all the attention, all the, clues that it receives from the environment. It is only going to, store so much relevant that is required in the long-term memory, and that is what learning has to be, right? Learning repeatedly, right, helps us cement the long-term memory. You'll have to revisit what you have read once, again and again, to cement it into the long-term memory. Then in the process of that, when you are, let's say, for example, reading material again, that means revising, right? You will remember some bits and you will have forgotten some bits. Forgetting is absolutely normal. Sometimes we just bash ourselves up thinking that, oh, this is very foolish of me. Oh, I forgot. Okay, and I don't remember. Maybe I'm not up for it. Maybe I'm not worthy. No, that's not the thing. Forgetting it is a very natural part of the learning process, right? So, how do we change this? How do we remember long term, right? So, understand here what works, right? So, what works is that we have read the material, we have, made our own notes, we have tried to condense whatever we have read, right? And then we have to revise it at a later point in time. Now, strategy based revision is very, very important. I mean, we can't have it like we read something today, revise it again the very next day and then forget about it and thinking that we will remember it in the long term, right? Nobody has that kind of photographic memory, right? Maybe barring a few. Other than that, yes, you have to understand that you have to space out your revisions, right? Please understand, it may feel counterproductive or counterintuitive. You may think that what am I saying, but listen to me, right? The harder you try to recall an information, right, the more effort you make in digging out a memory or something that you've memorized, or the harder the effort you make in you understood a concept and then you're revisiting it a week later, and the harder the effort you make to remember it, to decipher it, to draw conclusions from it, the effort that you make, that clinches memory. That cements memory. And that is how, you remember, neurons and synapses and pathways in the brains, they are activated in the effort that one makes to recall an information. Without that effort, long-term memory doesn't sink in, right? So this is what we call as spaced repetition. So space your repetition, space your revisions out in a manner that, okay, you have to make an effort to revise. It's fine. That effort is going to help you build the long-term memory. I'll give you an example. For example, when you are driving a car around, and when you have, nowadays you have Google Maps and everything, so they just keep telling you turn this way, turn that way, and then you reach your destination, right? And I don't know, sometimes if you figured, that you have gone to a destination so many times when you're not driving, when you're sitting behind your cab, but you do take that route every day, right? Via those Google Maps, right? But somehow you don't remember the way. But when you drive the car on your own, right, and maybe someday you took the wrong turn, and then you realized, oh, this was the wrong turn, and then you went around and, came and took the right turn, you don't forget the right turn after that. Then you made a mistake there. That was the wrong turn. And then your brain tells you, okay, this was the right way. And then you remember the way. Right? So think about it, this is what you're doing. You're driving your own car here without really any Google Maps. So yes, in that sense, you will make your own mistakes, but then again, making those mistakes is very crucial for, cementing long-term memory. And this is what we call as the concept of active recall. Active recall means, see, revision is not just rereading whatever you read again and again and again. Okay, so yes, when I say revisit, you do have to revisit and revise, right? But then the pattern of revision cannot be just rereading all that material again and again and again, because then your material is so big. Each time that you read or revise, it has to be condensed into more and more, less and less condensed, revisable notes and material, right? So active recall is, let's say, for example, when I said that you try to recall the information with your book closed, right? You give quizzes, you attempt, MCQs, or you, when you're doing for your final professional exams, you take those past year papers and then you formulate your own answers, right? Self-testing is very, very important. Right? So what is the difference between those students who write the paper in the examination hall very fast and they don't even fill too many sheets, but they get good marks because they have practiced those answers, You have to practice those answers, right? So that is what works. You have to always link concepts and application, right? Just memorizing concepts alone is not going to be helpful, right? You have to understand where is its clinical application. When you try to remember it like that, then it goes into long-term memory. And also try to rotate the topics and rotate the subjects while studying, instead of, just focusing on one subject or blocking one subject, together at a time, right? So mixing anatomy, physiology, pathology, you'll have to take all these subjects together while you're reading them, because that ways, you're also again training your brain to at the same time, trying to recall information from different aspects of the different subjects, right? So that is what is very, very important. Try to rotate topics and subjects while reading. And also remember here that always ask questions, much of our learning stops when we don't ask questions. So even if you feel that it is a stupid question you may be asking, or even if you feel, one has to get over that fear of asking questions, right? So ask questions, discuss with your friends, so basically medical learning now can no longer be sort of isolated learning, Of course, you will have your alone time studying also, but make it a habit to, discuss with friends, right? Because again, when you're discussing a topic with friends, you are describing and summarizing in your own words, right? I read this. And many times it helps, you teach me this, I teach you that, right? So remember, you'll have this, student in your group who will be the teacher. He'll grab those bones and from anatomy, and, he'll teach you everything and everything. So he's teaching you with the book closed. And what is that fellow doing while he's teaching? Actively recalling, passing it on to you, cementing his long-term memory. So teach each other. And sometimes, when you can't even find that friend you want to teach yourself. It may sound very stupid to do that. You're in a closed room doing what? I'm teaching myself. You're speaking it out loud. You're trying to teach yourself. You're recalling. That's active recall at best. Do it, right? So that works. Now, what are the mistakes that you need to avoid? Relying solely on memorization. Okay, so the goal is not to memorize every fact. The goal is to understand the core idea, okay, concept. Passive reading, isolating concepts, that is something that you need to avoid. You need to build basics. You have to link different concepts. You have to practice and analyze where that concept is applicable, okay? So that is how it is going to help you. You have to integrate topics, integrate subjects, rather than treat them as isolated topics and isolated subjects, right? And the one mistake to avoid is stop comparing yourselves to others. I mean, the structure of academics that we've all gone through, I mean, in school also for that matter, it always mattered which rank you were, what percentage you were getting, what score you were getting, where you stood in class. So it was all about comparing yourself to others. But now that you are here, okay, all of you are the very best of the lot, right? So there is absolutely no, there's absolutely no need to compare yourself with others. Focus on personal growth, right? Seek help where needed. Help could come from friends, from people who matter to you. Help could come from faculties. Help could come from family. Wherever, keep yourself surrounded by people who are there to help you, who are there to understand you, right? Rather than bring you down, okay? Also, ignoring rest and hobbies is something that I would say is a mistake to avoid. If you have any hobby, pick that up, build on it, do not leave it on the side, right? Okay, because ultimately we also as human beings are a whole package. We are more than what our marks are, we are more than what our academic achievements are, right? So celebrate all your achievements, celebrate the small wins also. Like for example, you decided that I'll sit for 1 hour and study, and you did, and you grabbed a concept, you understood, you finished these 4 pages. Treat yourself, sit down for 5 minutes, just kind of relax, rest wisely, I would say, and do not compromise on your sleep as well. That is very, very important. In the end, please remember, like I said, and like that learning is something that needs to be effortful. Then only it is effective learning, right? You may think right now that your professors, how do they remember all of this? How do they quickly come to the diagnosis? And, how is it so effortless? Like, for example, you may think, oh, a surgeon, how is it so effortless, right? It looks effortless right now because a lot of effort has gone in to make it look effortless eventually, right? So it has come through the process of more effective learning techniques, always testing ourselves, right? Keep testing yourselves, keep learning. It has to be in the right direction. The goal is to become good clinicians. The goal is to treat a patient. The goal is not to make glaring mistakes in patient care. If that is your goal, every step in the learning becomes easy, right? Right strategy is important. Discard, give away the techniques that are not working for you. If you're trying something, trying some different way to study and read, if it's not working, be open to trying new ideas and new strategies as well. And if something works for you and has been working for you, stick to it, right? But just go ahead with the right strategy which works for you. And at the end of the day, the right mindset is equally important. Let not failure define you, right? So there's a difference between I am a failure and I failed right now. So if you failed right now, you can always succeed the next time. But when you say that you're a failure, then that is, you're adding a label to your to what you can, or what you can do and what you can achieve. So with this, happy learning in the MBBS years. Thank you so much.